All right, well, we're going to go ahead and get started on time, recognizing that others will likely join us. Welcome, everyone. I'm Katrina Gay. I'm the Acting Chief Development Officer at NAMI, and it is my real pleasure to be able to connect with just all of our partners in one place and be able to host on behalf of me and my organization this conversation today on employee resource groups and mental health solutions and employees in general and our customers, and just really share some great ideas and some thinking around what people are doing internally and externally right now to ensure that their workplaces are welcoming and encouraging of individuals, families, and friends who live with mental health conditions. The focus today will be on employee resource groups and internal focus, but I just want to stress that while you may be a company that's smaller, that does not have an employee resource group construct, a lot of the ideas and thinking shared is applicable regardless of the size of your organization, and hopefully we'll seed some of the thinking as we begin to recognize that our role in supporting these healthy workplaces does include mental health in a big way, and perhaps even a bigger way since the COVID experience of 2020 and continuing. So I'm going to go ahead and just give a little bit of an overview of NAMI. I'll go over the agenda and a few things. I'll try to move very quickly through this so we can get to the big part of the discussion. First, our agenda. I'm doing some introductions. Then we will have a facilitated panel discussion. I'll hand it over to some of my colleagues to welcome you as well. Our guests today are AMN Healthcare, the Hartford, and Boeing. Our board member, Vanessa Fernandez, is moderating the panel. We'll have an open discussion for Q&A and then close it. And with that, Vanessa will talk about how you can ask questions throughout and what our process will be throughout the narrative as we kind of walk through the agenda. Next, please. So I'm going to give just a very quick high level. Most of you know NAMI, but just so you have we're all on the same page. We are the nation's largest grassroots mental health organization, and we are dedicated to building better lives for the millions of Americans who are affected by mental health conditions. We have more than 600 local NAMI state and affiliate organizations across the country who unite with us in support of our NAMI mission. So we are national, state, and local all across the country, delivering much needed, vital services and supports, advocacy and awareness to build healthier communities and help support individuals and families. Next. So 1 in 5 adults experience a mental illness each year. I really suspect we do that number will be climbing. All of the data that we have now coming out of COVID for the last year really tells the story of the impact on our own mental health of the pandemic and related social, economic, and other isolation and other circumstances that really began last year and continue into now. I'll talk a little bit more about youth in a minute. And like I said, we really do provide these individuals with free, no-cost programs and support, virtual, in person, and a variety of initiatives. Our goal is building and helping to instill hope so that people can endure and find their best selves and be their best selves. Next. So a little bit about children and youth. While this affects all of us, this particular group, I just think I want to underscore at the beginning, it's not just us, it's this next generation coming up that are also coming into our workforce that we know are impacted in much greater ways. First, we understand that 20% of all youth ages 13 to 18 live with a mental health condition. These numbers were pre-pandemic, I want to stress. 50% of all lifetime cases begin by age 14 and 75% by age 24. So new, younger people coming into the workforce are at that ripe and prime age to be experiencing their mental health condition. 25% of youth during the pandemic are considering suicide each day. So that is 1 in 4 of our youth are feeling a sense of desperation and serious consequence due to the pandemic. At the same time, we know that the gap between experiencing or early onset of our mental health condition and actually getting treatment is long, sometimes as much as 10 years. And so we really want to try to shrink that gap and make sure that we can be encouragers of recovery and of wellness, because we know that with treatment and supports, people can get better. Next. A couple of quick statistics about the pandemic. So as I mentioned, young adults are impacted, but what we know is they're 5 times more anxious than older generations. Now, this isn't just important for the workplace, because many people in the workplace are parents or grandparents, aunts and uncles. So they also, or brothers and sisters, and are thinking about their youngsters, whether they're at the workplace or not. And I mean, I don't know about you, but I see this every single day in the workplace with people very, very much concerned about their kids back home or at home with them when they're trying to kind of help work at home and still manage their kids that may be struggling. Also, overall rates of psychological distress more than tripled from April 2018 to April 2020, with young adults showing the most dramatic increases. So that was a real nice benchmark. And then nearly 1 in 25 or 10 million adults live with a serious mental illness, schizophrenia, bipolar disorder, different conditions that include psychosis, etc. It's just a little bit about the scope of what's going on. Moving forward, we really want to highlight and turn now to what can we do in the workplace. So NAMI will be producing and distributing next week a guide on Mental Health Month, which is the first big calendar event of the year. Our theme will be "You Are Not Alone," #NotAlone. We'll be doing some challenges. There'll be some different events happening throughout the month that you can kind of use to benchmark around or engage in directly or use as springboards for your own. This is just part of the calendar. We have a very extensive calendar available that we'll also link to as part of the guide so that you can begin to plan some of your events at work. So for example, you may want to think during Black History Month, maybe also addressing Eating Disorders Awareness Week or the specific issues of Black Americans and mental health. During Women's History Month, which is also Self-Harm Awareness Month, you might want to look at tying it in or working with your women's leadership ERG if you have one, or even focusing on the issues of women and mental health conditions during March. Mental Health Month is also Women's Health Month in general. And leading up, thinking about LGBTQ Pride Month, Minority Mental Health Month, National Hispanic Heritage Month, which is also Suicide Prevention Month, and then World Mental Health Day, which is always during Mental Illness Awareness Week in October, or it's October 10th, actually. So all of this, not to overwhelm you, but just to help kind of let you stand back and say, there really are a lot of times throughout the year that we can begin to kind of weave in, work collaboratively with other employee groups, or create a calendar where there's some sustained rhythmic education and awareness happening. We don't have to do it all in May, so no pressure, no stress. We can do things throughout the year, a little bit or a lot, it's all up to you. So with that, I'm happy to also just welcome all of you here. We have 64 participants on. Thank you so much for your support. It's through the partnership and the funding of the partnership program that enables NAMI to provide so much of what we do free to the people out across the country that need it. And you support our vital work. We're incredibly grateful for that. I'm happy to introduce the NAMI CEO and let him welcome you, Dan Gillison. Thank you.
Good afternoon, and thank you, Katrina, and welcome to everybody on this afternoon. And before I move forward, one of the things I wanted to note as Katrina was walking you through the calendar, May is also Asian and Pacific Islander Month. And given what's going on in our Asian American community right now, I just wanted to mention that and thank Michelle for sharing that with us. To any of our members that are with us that are experiencing what's going on in America right now, you are not alone. We are in this together, and we feel with you and for you. So now with that said, I'm an old guy. I started with ERG back in 1979. When we talk about employee resource groups, back then they were called caucus groups. They matriculated through to affinity groups, and they're now called ERGs. I will tell you that the communities of caring, development, mentoring, support, the coaching that I was able to realize through being a part of multiple ERGs through my private sector career, I will tell you that they are outstanding, and they're the lifeblood of organizations and companies. So kudos to all of you all that are parts of ERGs, have them inside of your portfolio within your organizations, and they are so relevant in today. And these are employees who care and want to be a part of something larger than themselves. So with that said, let me introduce the moderator for today, someone who I just respect tremendously and just enjoy working with so very much, and that is Vanessa Fernandez. She is a NAMI national board member. Thank you, Vanessa, for that. And she leads and supports development efforts with our board. She also leads diversity, inclusion, and belong efforts with ERGs at Nordstrom. So I want to say that again: diversity, inclusion, and belong efforts at ERGs, with ERGs at Nordstrom. Very important in terms of the labeling there. Vanessa is very passionate about engaging communities and organizations that support mental health programs, policies, and initiatives in the workplace. And now I'd like to introduce to you all Vanessa Fernandez. Vanessa?
Thank you, Dan. Thank you, Katrina. And thanks everyone for being here today. Thanks for spending the afternoon with us. It certainly is nice to spend some time with like-minded companies in the room, in the virtual room. So thank you. Our panelists today, so allow me to introduce our panelists today. First up, I'd like to introduce Kelly Carter. She is the Director for Media, Public and Community Relations for the media. I'm sorry, I messed this up. She is the Director for Media, Public and Community Relations at the Hartford. The Hartford, as we know, is a leader in property and casualty insurance, group benefits, and mutual funds. The Hartford is also widely recognized for its service excellence, sustainability practices, trust, and integrity towards we love. Thank you, Kelly, for being here today. Next up, we have Tara Sherman. Tara is a member of the Total Rewards Global Benefits Strategy team at the Boeing Company. She leads the development and execution of the mental health and well-being strategy worldwide. She's working on ensuring inclusion of local market practices and culture for the Boeing Company. Thank you, Tara, for making time for us today. Next up, we have Brian Scott. Brian is with AMN Healthcare, and he has been their CFO since 2011. Brian is also the co-executive sponsor of the Open ERG at AMN. That is one of 7 ERGs that AMN Healthcare has in the workplace. And we know that Brian is a huge advocate for lifting the stigma on talking about mental health, particularly in the workplace. So Brian, thank you for being here.
Thank you.
And last but not the least, we also have Dan Fisher joining us. Dan is a recruiting manager with AMN Healthcare. He is also the leader of the Open Employee Resource Group. In addition to the work that he does at AMN Healthcare, he is also a service dog ambassador, and he works on raising awareness for business leaders in relationship to psychiatric service dogs in the Ohio region. I bet and I believe his dog, Dustin, his service dog, Dustin, is by his side today. So welcome, Dan and Dustin.
Thank you.
Well, I'll tee this off with a question for each of you. So we'll start with Kelly, head on to Tara, Brian, and Dan. Tell us about where mental health sits within your organization internally. Do you have a specific ERG dedicated to the issue, or does it sit with another group like wellness, health, or diversity? So Kelly?
Thank you so much, Vanessa, and thank you to NAMI for organizing today's event and inviting the Hartford to participate. We really appreciate this opportunity to share our experiences, and we hope to learn from other NAMI partners. So the Hartford's core belief is that people are capable of achieving amazing things with the right encouragement and support. And so we feel like this event just rolls into that, providing others with encouragement and support. And we support NAMI's core belief that mental health is integral to wellness. And today I'm going to be talking a little bit about, what we do as an employer, as well as what we do as a leading provider of workers' compensation and disability insurance. And both of those, mental health is just part of our company culture. And so when we talk about who owns this mental health as a topic, today I'm going to be sharing efforts by a variety of people across the enterprise. Initiatives by our wellness team, our benefits team, diversity and inclusion organization, efforts by our employee communications team, but also ERGs. We have 9 ERGs at the Hartford, and they just have amazing membership, about 9,000 distinct ERG members, which is about half of our employee population. And several ERGs have been engaged around the topic of mental health, such as facilitating our courageous conversations on mental health stigma, planning education and awareness events. And so an example would be recently, our Black Insurance Professional Network recently sponsored a webinar called Mental Health Managing Through COVID. And our Flexibilities Network, which is the ERG that is looking for ways to help employees and our customers and our communities be fully capable, the emphasis on abilities. FAN is talking about activities for May Mental Health Awareness Month. So really, again, it's across the board. It's a team effort, and thanks again for the opportunity today.
Thank you. Tara?
Hi, everybody. So I think as represented by the different parts of the organizations that we all come from, when addressing mental health in a corporate or work environment, it really takes a village. And so the mental health strategy does sit in our global benefits group. However, we have really strong partnership with health services and our employee assistance program, as well as our well-being champions, our well-being delivery team, and leaders throughout the organization. So where someone has to ultimately kind of own the strategy, we really rely on such a wide group of individuals, groups and individuals, in order to bring things to life and make sure we're reaching everybody. We do a lot of really close partnership work with our ERGs. We don't have one dedicated to mental health at this current time. However, we've done a lot of partnership with our Pride group, making sure that we have specific resources available for those team members. So we've created a very specific flyer with all of our resources that talks specifically about how you can find a provider for your unique needs. This summer, we created a resource of therapists that specialize in racial identity and got that out through our Boeing Black Employee Association group. So we're really trying to listen to what's needed in the specific BRGs and help deliver that. At some point, we may have a specific mental health BRG. We call them business resource groups. We don't quite yet, but like I said, I think we've done a lot of really strong partnership that has helped support there. They are our most active employees. So for all of us here today talking about ERGs, it is a great group to go to in order to get messaging out, in order to seek and understand what different needs are for our employee population. So regardless of how the partnership happens, I think one thing that we'll talk a lot about today is how that partnership is just really key to to integrating mental health in our organizations.
Great, thank you, Tara. Tara, you touched on something that certainly makes sense to even smaller organizations. Even if you don't have a mental health ERG yet in your organization, it does make, there is a room for intersectionality with almost every ERG. So thank you. Before I move to Brian, presenters, will you make sure that your microphones are muted? Thank you so much. All right, Brian, you're up next. Thank you.
All right. Thanks, Vanessa. And again, thanks as well from AMN for having us here today. Really impressive things that Boeing and Hartford have done. We are, I guess we'll be the smaller of the companies here today. We have about 3,000 corporate team members. And for those that may not know AMN Healthcare, we provide healthcare staffing services and other solutions to our clients. So we have about 10,000 healthcare professionals working on temporary assignments across the country, and about 3,000 corporate team members across the country that support that initiative. So, very timely for us, with the last year being such a challenging one for our clients managing through this pandemic. Mental health clearly at the forefront of a lot of those discussions. But, our journey with ERG started about a little over 3 years ago. We have 7 ERGs today. They're all, like I'm sure like every other company, they're really all employee born and led. I'm the CFO of the company, and all of our executive team members have a commitment to be serving on at least one of the ERGs as sponsors as well. But Dan will be able to talk really more about the day-to-day and the focus of the team. But I'm really proud to be part of this particular ERG. It really aligns to AMN's strategy overall. We're a very people-centric organization. We think that our people are really the power of our success and how we run each and every day. And so we invest a lot in a variety of different ways and how we can support all of our team members. And the ERGs are ones that we take a lot of pride in, not only because it's an opportunity to really support our team members, because they're really employee-led as well. And so I've been involved in Open for about the last year. It really aligns to our DEI initiatives overall. We try to invest a lot there. We've had wellness champions over the years as well. That's kind of some of this is started as well. We also have a Zen at AMN. So we have for our team members to go through and just taking a half hour to just kind of step away, and usually one of our team members will lead them through breathing exercises, other things too, just to take the time to take a break, invest in themselves as well. And like I said, I'll let Dan cover a little bit more about it. We have all the traditional employee assistance programs as well. And as we maybe touch today, I'll talk a little bit what we do for our healthcare professionals, but the ERGs are really focused on our corporate team members.
Thank you, Brian. Dan?
Yeah, so my name is Dan, and I'm one of the 3 leaders of the Open Employee Resource Group at AMN. I'm sure it's probably similar to other companies, and we volunteer for these roles because we're passionate about the issues that we discuss. And I started taking leadership with the Employee Resource Group, I want to say it was back in June. And since then, we've kind of seen a couple things happen within the natural climate, the pandemic, the insurrection in January at our Capitol, and it just seems like everything kept snowballing. So we're finding ourselves uniquely positioned to where we have a lot more employees seeking help from us, seeking guidance, seeking resources or education about mental health problems than ever before. And our role has, quickly shifted and changed to kind of help employees that are looking for that information and pointing them towards the right resources that we have available.
Thank you. Thanks, Dan. Kelly and Tara, this question is coming up towards you. So for companies that are thinking about scaling their efforts around mental health, can you give us some examples or some ideas as to how you worked on dedicating resources to this topic within your organization?
So I can start off by saying, we've done, like I said, a lot of efforts were done by different teams, particularly our health and wellness teams that sit in HR. So they've done a lot of work in this area. And, thankfully, the work was being done. It was based on data-based decisions, like looking at the data, seeing where the need was. So like in 2019, we had an increase in our EAP visits for employees and their families because we saw in the data that there was a need, that there was increased use and visits. So that that helped us in bringing on other benefits within this past year has been really helpful from a, again, from a support perspective for employees. And as a workers' comp and disability provider, we've always been focused on mental health, or understanding that based on our experience, it's a key part of somebody's wellness, and helping claimants, injured workers, or employees that have been facing with a medical condition, getting them back to work. It's important to not forget the mental health aspect. And that's important to get people back to active, productive lives after a disability or an injury. So we kind of have those both forces, the business side and us as an employer for our journey. And that's where I said it's important to think about like the different aspects of our business, or bringing forward the effort. So and anytime we're bringing forward the discussion externally, we want to have it based on what we're doing internally too. We want to be able to walk the walk and talk the talk. So if we're raising this as a workplace issue with our employer clients, then we're also doing the effort among ourselves.
Thank you, Kelly. Sarah, you guys have a global presence, so how do you make a decision to dedicate resources to this topic?
We were really fortunate that we have a few leaders who felt really strong about supporting mental health early on. I think that it makes sense from a business strategy perspective, but it also makes sense from a human perspective. And I think what many of us find that are involved in this work and very passionate about this work is you're usually touched by something pretty personal that gives you a drive to make sure that you're doing all you can to support mental health wherever you can make that influence. And so I do want to mention something, because I think that we are a couple of large companies and one smaller, and I think that's a really good point. And I think that there's both challenges and benefits of both small and large. So I do want to say that there's some things that I might talk about that might be a little more challenging, but we definitely have our challenges reaching in such a big environment too. So no matter how small you are, I think there's still lots of amazing opportunity, and probably in a kind of higher touch manner. But I'll leave the experts to talk about that, Brian and Dan. So I will say we started about 5 years ago really looking at our network and making sure that employees had access to care. I think all of us know how challenging it can be once somebody makes the decision to seek support and care, even finding someone that can take them in a reasonable amount of time. So we had carved out our network out of our health plan and made the decision when we looked seriously at the network to bring it back in. So it's a specific part of our health plan network now. We also have brought on some other partners that I can talk more about probably a little bit later in order to make sure that people can access care along the continuum, because we want to make sure someone can access something if they need coaching, all the way through different types of clinical support. The opioid crisis has been a big area of focus for us too. And so we've worked with our plan to make sure that there's enough treatment providers in the areas that our employees are in. And so we've done a number of things there. Then in 2019, we were hit with probably one of the toughest business environments that our company has ever been in, with the 737 MAX. As most of you are probably aware, there were 2 crashes and the grounding of that plane for an extended amount of time. And our company has always taken great pride in our quality and safety of our products. So it hit everyone hard, but especially the employees working on that plane. And so we really upped our efforts in terms of both in-person support and different programs for those employees. What happened then is we rolled right into the pandemic. So we were at least already in a rhythm of putting a lot more emphasis on this area, and so we were able to kind of continue that into 2020. We switched a lot more virtual, but we probably also shifted some of our efforts, not giving up on access, but for the immediate efforts during COVID, to education, to news articles, to timely information, to help support people and make sure they knew that they aren't alone. And here, not only is there information and tips and tricks, but also reminding them of the different ways that they have to get support.
Great. Tara, I have a follow-up question for you. So when speaking about mental health internally, you guys certainly do that. Do you talk about mental health externally? And I'll ask the panelists, each of you, each company, what are your thoughts on that?
It's a great question. At this point, we're pretty heavily focused internally. We may at some point do a little bit more external. We have done a little bit. We had a wonderful leader. He's moved on to a different company, but he was a veteran, a Medal of Honor recipient, and he talked very openly about some of the challenges that he experienced. And in a company that employs a lot of veterans, it was something very relatable for people. And he has done some stuff externally. We haven't done a lot though. So we are in the process of starting up an executive champion, actually, one of our executive committee members. And I think that will be a foray, perhaps, into a little bit more. So I'm hoping that we can continue our momentum internally and then start to send some messages externally too, because I think the more that are supporting this, the more we can bring people along on the journey.
Excuse me, everybody. I just want to say hello. I apologize for being a little late. I have left a call. I'm Welton O'Neill. I'm the Vice President of Medical Affairs at Supernus Pharmaceuticals. So pleasure to see you all and to listen in on the conversation.
Welcome and thanks for being here, Welton. Thank you. Kelly and Brian, I have the same question for you. Do you guys talk about mental health externally with your external stakeholders?
Thanks, Vanessa. We do a little of both, or really, we started a lot, again, like our employee communications teams, our ERGs, wellness and benefits team have been talking about mental health internally for a while and holding events, communications, building in more access to resources, communicating out so people know how to access those resources. It's been within the last year that we've also been talking more externally about mental health and from a senior leader perspective. So again, we have clinicians within our line of business that have been talking about mental health and in the context of workers' compensation and group disability. But so about 2 years ago, our CEO and chairman, Chris Swift, started talking to the business community about the opioid crisis and how there's a need for public-private partnership, an all-in effort to help end the opioid crisis. And within the last year, he's been talking more and more about stigma and the need for everyone to address stigma associated with addiction, but also the importance now of talking about mental health. And I think those folks at NAMI know that often they're hand in hand, that there's been data that shows half of adults with a substance use disorder also have a mental illness. So we feel like it's important to talk about stigma associated with mental health and addiction. When Chris Swift is talking externally to the business community about the need to have education, culture change, and support from a public policy perspective, he wants to be authentic. So we're walking the walk, we're talking the talk. So we're trying to do all those things internally, do those things ourselves when he's going out and talking about the business community and trying to get more engagement around the topic.
Well, thank you. And please thank Chris for all the work he does externally as well. Brian, did you want to add anything else?
Sure. I might start just internally again. I think, although we are a little bit smaller than many other companies, I think we are, it feels like we're a little bit at the forefront in terms of having an ERG that is dedicated to mental health. Take a lot of pride in that. Again, it was all born out of our team. I think it speaks to the culture we try to create where our team members were willing to step out and create this, kind of raise their hand. You can imagine there's a lot of the team members that are involved in this and really dedicated. They've been willing to share some of their mental health journey as well, which we're really appreciative of, because it really, the more some of our team members are willing to be vulnerable, it really allows others to feel like they can also share their story as well. And we want to be there to support that as well. So I think, again, as talk about lifting that stigma, it really has to start somewhere. And I think our organization supporting our team members, sharing their personal journey and making sure we're there for them, I think does a lot to ensure that they kind of can be the best that they can be each and every day as well, and others feel like they have that opportunity. So I'm just so proud of our organization overall in supporting, bringing this to light, and organizations like NAMI, providing so much great resources as well. So I think that starts for us internally. In terms of external, we again, being in healthcare, we are partnering with our clients every day, and we also try to provide a lot of thought leadership. So for many years, we've surveyed our nurses and physicians, and mental health is a part of those surveys. Typically, you can imagine stress and burnout in the field, and we share that information back so that we can provide information that we're seeing in terms of the challenges that that the healthcare professionals that serve our clients every day, their word is getting out there. And it's much broader. These surveys cover more than just those that work for us as well. So that's one part of it. And we are talking to externally, I think we talk to our clients a lot about it as well, because as we understand what journey they're going through and the challenges they're seeing from burnout, from mental health, we want to figure out how we can partner with them to help them through that as well. And then as I mentioned, we have about 10,000 clinicians working across the country at any one time, but that means we're putting to work, probably 30,000 plus each and every year. And so we do provide employee assistance for them. And we have a whole clinical leadership team that's fully dedicated to serving them. And they're dealing with a variety of different issues, but you can imagine, mental health is one of them. And so they have an outlet from very experienced clinical leaders to deal with any issues that come up as well. So I think there's more we can do as we just think about more broadly communicating externally, but we don't have a kind of a core strategy right now about that, messaging beyond our clients and the people we work with each day. I don't know, Dan, if you want to add anything.
Yeah, one of the things I wanted to add, I joined our company. My 2-year anniversary is actually this past week. But, like a lot of employees that are new to an organization, we're not real sure if we're going to stay with that company for the long term or if it's going to be for the short term. And working in sales and as a recruiting manager, I was, and probably not the best thing to admit my CFO online, I was stuck in a limbo spot where I was wondering, is this a company where I could see my future with, where I could retire with? And going to an ERG meeting to talk about mental health issues and having that conversation was just so empowering, because it's a taboo topic that a lot of us don't want to have, and we don't know how to start that conversation. And not only do we not know how to start that conversation, we don't know how to respond when other people bring it up to us. And I think I left that first ERG meeting knowing that I had found my career home, and that AMN was going to be that company where I looked to them for the retirement options and all those things that we start planning on. So these ERGs, and I know others that are members of our ERG, we're having them internal conversations. That's part of the lure of being part of the AMN family versus one of our competitors, is we know what to expect. The conversations are already happening about mental health, and we know how to have those conversations appropriately in the workplace.
Thank you, Dan. And I've actually seen AMN employees stay connected over mental health from the East Coast to Central and West. And the way you guys work, even through this hybrid work from home kind of thing that we're all going through, the passion for the work certainly comes through. So thank you for sharing that. The next question I have for you guys is, what kind of initiatives have you launched this year in the workplace? Anything that you're super proud of that you'd like to share with us, with the audience? And I really will open that up to any of you.
This is Tara. I can start. We, because so much of our workforce went virtual, we did a lot with educational webinars, and I think this is something that most of us can do because we utilized our key partners. So NAMI, being one of those key partners, did a couple of fantastic webinars for us, just in time and very credible. I think I see NAMI quote, the most statistics I see on mental health quoted are from NAMI. And I know I'm not alone. So NAMI is a very credible resource for our employees. So we organized a couple of webinars that way. We also have had our EAP program has been doing webinars continually at times that work around the globe so that we can get that participation. We've also used our health plan for some expert webinars, as well as our coaching program that we have many specific topics on. So I think that's been kind of that just in mind, that just in time, those reminders, helpful hints, as well as a place for employees to come together through the chat and share tips and, really, again, feel not alone in this, which is very easy to feel these days. The other thing is, I talked in the beginning about increasing access to providers. And so we actually worked with our health plan to create behavioral health navigation. So now if someone calls and they're asking about mental health or behavioral health, the navigator will offer to help find them a therapist or psychiatrist or whatever their specific need is for, with their specific preferences might not be the right word, but with what is important to them, and also even offer to make that first appointment for them. So we're really trying to break down barriers that exist to getting access to care. So we've done a few more things, but those are two, I think, that at this point in time have hopefully made a difference for our employees.
Great, thank you. Did any of you want to share any other initiatives that you are?
Sure,
Go ahead, Ken.
I can jump in. So we've had courageous conversations at the Hartford for years, and those are a safe place for a tough topic that people can listen, as well as, share their experiences, have a dialogue around the topic. We've had them around every issue that you can think of. But in the past couple of months, we've had a lot of courageous conversations around mental health stigma. And I'm so proud of our ERGs. They've really stepped up. They've facilitated those. Some have been facilitated by our D&I organization. And our employees are just so grateful. They're overwhelmingly positive comments about the opportunity, even just to listen. Like, for some people, this is their first courageous conversation ever, and they're just so appreciative for the opportunity to hear a coworker, which shows they're not alone. And that I think that peer-to-peer support has just been so welcoming for our employees. They've just been overwhelmingly saying they're grateful for the opportunity to share their experience, to hear. They appreciate that the company is promoting these. Like, we want people to share their experience, have those conversations. So I think I'll have to look and see, I think there's 700 participants that have been engaging in these courageous conversations just within the past couple of months, and more are scheduled. So we definitely see that as something that we will continue, because we're seeing so much positive outcomes from that.
Great, thank you. Thanks so much, Kelly. I have a couple of comments in the chat. So first, I want to acknowledge Ray's comment on the fact that, candidates find that transparency around the mental health focus certainly helps their company. Ray, I don't know the name of your company, but kudos to you and your company. And then Lauren has a question or wants to share something with us. So Lauren, go ahead.
Hi, so I work for Paylocity, and I just wanted to share like kind of a little grassroots thing that I did for the group that I support here at Paylocity that has gone over really well, and it was really simple for me to put together. So because of the impact of COVID pandemic, everybody going remote, all that stuff, and mental health being at the forefront, I did what I call a stress management program. And so once a week, I used our intranet either to post a video or a little post, and it would just be like a little bite-sized stress management tip. So it would just be like, you know, this week we're going to focus on, everybody make sure you put a break in your week this week and stick to it. Or just very simple tips and tricks every week. And then had employees volunteer to share tips and tricks as well, either via video or whatever. So they were almost sharing with each other too, what they were doing to kind of manage stress in the pandemic. And we got a lot of really positive feedback. Again, it seems small, but it definitely made an impact.
Thanks so much. Thanks for sharing. Let's see. Lauren, I forgot to ask you, or I know you mentioned the name of your company, but I'd love to see it in our chat so that I could follow up with you. So to the audience and to our panelists, my next question would be, what can NAMI do? So many of you are our partners. Some of you are thinking about working with NAMI. What can NAMI do to best support you in addition to what we are currently doing for you? Kelly, you're on my screen, so I'll go with you first.
Oh, thanks. And we're a relatively new partner with NAMI. We, joined forces at the end of last year. And we immediately had Dr. Duckworth as an expert on a webinar, a virtual webinar for our customers, for HR professionals, for other folks, brokers that were interested. And he was just so helpful. We also had Dr. Crawford at 2 internal events over the winter. And again, great expert advice, both really explaining the topic, explaining mental health in the pandemic, making it okay to be not okay, understanding, the impacts and how what we may be feeling is normal. We had Dr. Crawford in a conversation with our CEO and the head of HR, and it was a great conversation. Simply just even having the opportunity for Chris to say like, hey, I'm feeling like tired, like everything takes a long time, and normalizing talking about like how you're feeling. And having Dr. Crawford, talk him through that and what we're all experiencing. So I love the expertise that NAMI brings, because like as a work disability and workers' comp provider, we know it's an issue, but we need the NAMI's expertise to, talk about the right language, how we should be talking about this. I think our employees, our managers, brokers are asking us, like, how do I talk about this? You're saying it's an issue, but how do I bring this up in a meaningful way in a conversation, or how do I help people? So your language guides are just so helpful so that we can empower people. So they're not only being educated about the topic, but then they're being empowered to help people either provide support or connect them with the right treatment or resources. So I say keep doing that and helping us, help each other.
Thank you for touching on the language guide. And you're right, not every one of us is equipped to handle a discussion in the workplace when an employee that may be needing resources comes to you. So thanks for touching on that. Any other partners or anyone else in the audience that has any feedback for us on what we could do to serve you?
If I could share something real quick, one of the things that we really enjoy about our partnership with NAMI is just the amount of resources you have that we can distribute to our team members. Most of our conversations are led on a Microsoft Teams chat or through emails that we send out to all of our members. And almost always there is some kind of a video that NAMI has put on YouTube, or there's a resource on the website or something like that that we're able to distribute to all of our members. And I think that's the one piece or one tool that you have that we find the most value in, just because we've used it so much.
This is Tara. I think that the partnership has just been fantastic over the years, and we've used a unique blend of partnership with NAMI National as well as some of the local chapters. So we have a Boeing Moves the World, a global walk one day. And the past few years, we've been integrating NAMI into it to really focus on holistic health. So it's not only the physical aspect, but it's the emotional and mental aspect too. And that was really cool to see the different chapters of NAMI, along with our employees all over the country in this case, participate together. I think the expert knowledge is just irreplaceable. We're very lucky, I think. We've also used Dr. Crawford. And so to have that expertise just at our fingertips, I mean, honestly, at a time where I was kind of like, I'm not sure what else to do. It was a pretty stressful time in trying to figure out how to best support your employees in the spring and summer, still today. And there was NAMI with so many solutions. So I'm just incredibly grateful. I would say keep doing what you're doing. The one additional thing I think that as an employer, would be really beneficial is more information on best supporting segments of our population. And that way, myself as a benefits leader can best partner with our ERGs. That would be just one piece, but honestly, I'm just incredibly grateful for our partnership and just how wonderful that the NAMI team is to work with. It's not just a good partnership; you're all wonderful people too. So it makes work really fun, and you guys are just a valuable part of our village.
Thank you, Tara. Summer just put something in our chat, and I'll share with you before I bring up Summer's question. I work with employees at different age groups in the retail space, and I find it really useful to use NAMI's social footprint. So every time I'm meeting with a group of employees, I actually refer to Dr. Ken Duckworth's last speech or our social content before I set myself up for a discussion in virtual rooms. So that's another resource that's out there. Summer has a great question. Dan or Katrina, I'd love to be able to pull you into this one. The main population in our company is young, 15 to 25. What are the resources that can be geared to mental health that focuses on that population? So Katrina?
Yeah, I'll just share some strategies that we've used over the years with companies. I remember going to a media company where the average age was 24, and it was huge and busting at the seams. And I was there, this was early in our sort of business experience, and I was their speaker. What I did to make it a little bit more palatable was I talked not directly to them, but to them as even like your brother or sister or your cousin, or because these were younger people. So or their friend, you may have a friend or a colleague, and it made it a lot easier for them to listen. Visually it looked like they were listening and absorbing the information. When I talked to them about, what are you going to say to a friend that is struggling? It was a way for me to get that information into their consciousness and for them to listen and hopefully absorb it without it feeling too direct. So the younger the audience, oftentimes the more indirect, and lead them to the discovery and let them sort of discover it as if, oh, that'd be really helpful for my friend Jane, when really it's helpful for us too. That's just one strategy that we've used a lot. Also, less words and more creativity. The younger the audience, the less kind of long narrative, the more short and broken up it is. And that's just, it just may, again, I know there's some science behind this, so I won't go into that, sort of how we absorb and how our brains work the younger that we are, but that really helps. And encouraging creativity as a way of sharing stories. So there's a lot to be done with this younger adult group around music, graphic design, art, animals, pets, just kind of lifestyle things. But when it comes to storytelling, poetry, these are a haiku contest. These are things that are a lot easier to kind of begin to start to get them to lean in. We know that when someone takes action, the belief imprints. So when you're learning and you're giving them information, oftentimes making sure, and that's really true for everyone, but especially true for this age group, giving them things that they can do that help kind of the learning imprint a little bit more, even if it's just a tiny take action. Write a gratitude note and stick it in the gratitude jar, something. All of those little tiny things can make a big difference. And my last one, when we were in the office, food. So food is like, if you're going to have someone come around, bagel party, something like that, or salad day, or something gets kind of helps glue the sense of sort of community together. And when you have community, you have, particularly for this age group, some of the barriers and sort of, I guess the walls and barriers we put up begin to start to drop a little bit. So those are some thoughts. There may be some more from the audience as well. Those are just some ones that we've used.
Thanks, Katrina. I'd love to hear from the audience on any techniques that you use at your companies. Brian and Dan, I have a question for you guys. How do you get AMN employees across the country to get behind this initiative, beyond the ones that directly report to you or work with you? How do you engage them?
Oh, that's interesting. I'll start. It's interesting with everybody working from home. I think in some ways it's actually going to level the playing field. You have to be careful with when you have a corporate office or headquarters that you don't become a bit centric there. And so I think it's actually allowed everyone to feel like they're equally connected. We focus a lot on communication across the organization, trying every possible means. And I love the tips on different ways to connect with team members. But whether you're using internet or email, using Teams, you have to kind of vary it, because otherwise your teams get a bit immune. So we try to really communicate, share stories of the different, whether it's ERGs or other initiatives we have, charitable or otherwise, really getting those stories out, because I think our team members feel more connected to the organization, and they're more likely to get involved when they feel really connected to what AMN stands for as an organization, what we care about. And if one of those things resonates with them, they're more likely to jump in as well. So a lot of it is just consistent communication. So all of our team members feel connected as well. Dan mentioned using Teams. That's been really helpful for us, because again, we're all very comfortable now working virtually and being on video and sharing information. I feel like we've accelerated the ability to share, and that pulls more of our team members in as well. And then ultimately, like I said, these are all of our, like all these companies and the ERGs, what I think the beauty of them is they're all employee driven. So they really, at the end of the day, they're all focused on what matters most to our team members. And so that, I think it's not a company driven, organization. It's really born out of, and you can see by the number of team members that want to get involved, what resonates most. And I guess unfortunately, I'd say I think our open ERG is actually seeing the greatest traction over the last year, not surprisingly with the pandemic. I think we may have more members than any other ERG at this point. It's not close to it. But I think that, when these spin up and you see team members joining that, I think, it reflects the fact that these are really important topics to them.
Great. Brian, I'd put you on the spot just a little bit here and ask you, as a CFO, what are some of the things that resonate the most with I'd say a finance team, not you, but a finance team when it comes to asking for investment around this initiative in companies?
Sure. I'm a big proponent. I mean, I said we do truly believe, and as a CFO, I firmly believe our ability to not only hire the best talent, but engage and retain is a huge benefit to the organization and our ability to be effective. Cost of turnover, I think, is just completely underappreciated. And so, from as far as I'm concerned, the cost of supporting ERGs is very low overall because it is so much about just the grassroots efforts of the team members. So it's a very easy economic decision for me if you really look at the cost of again retaining. And Dan, thank you for that beautiful story about your journey with AMN and thinking about us as a long-term vision. Like that one story alone, we just pretty much justified everything I've just said here. And we hear that on and on about people feeling like it's an organization where they not only feel opportunities to grow professionally, but they really connect to what we do as an organization, the way we support each other. And so if we can have that kind of power and passion around our team members, their engagement is so much higher. And so again, it's a pretty easy economic decision.
Thank you. Thanks, Brian. Dan, did you want to add about engagement of peers?
Sure. One of the things that we did early on, and it was almost as though the sun, the moon, and stars all aligned. It wasn't something we went and go looking for. Was and I think it speaks to the culture of our leadership. When I became the leader of Open, and that was communicated to our company, we got dozens of requests from leaders that wanted us to come in on a team meeting and take about 2 or 3 minutes to just tell them about Open, what our goal was, what our mission was. And we did that for probably 2 or 3 months, responding to every single request so we figure out a way to how to handle all those. But that alone brought our membership, I think we started at that time at 79 members. And within 90 days, we grew to over 160 members where we're at now. So we doubled our membership just by making people aware that we existed, what our goals were, having the conversations about mental health. And it also speaks to the need that our internal employees have, that they do need that information, but no clue where to start to find the answers they need.
Well, thank you. Thanks, Dan. Thanks for sharing. You guys, I had Michelle Young on my screen. And as I was looking at just her name come up on my screen, she made a comment earlier. I got to thinking about 2021. We all thought going into 2021, we might have a different and better year. And so far, it's looking like quite a challenging year for all of us, right? And so I'd like to hear from the panelists, so even the audience, I'd love for you guys to put it in the chat or ask questions or speak up. What are some of the things that you are working on to engage your employees in the workplace in the next few months in half one? Kelly, Tara, or audience members, who'd like to go?
I'll just quickly say again, we have an awesome health and wellness and benefits team. They organized last year manager training, again, so that managers can spot any signs of potential vulnerabilities, and that they can then refer people to the right resources. And this year, they're looking more closely at ally programs. I think if anybody has some great information about that, that would be really helpful, because we have a badging system. Like everybody on our intranet portal has their badges. Often the ERGs have an ally badge, and for folks that want to be an ally of their ERG. So it's just I think a natural evolution. So we're looking for that this next year. So I just think that's going to be a great opportunity for us.
Thank you.
I can add a few things. So we are actually looking at piloting a mental health ally program really specifically. I wish I could take credit for creating this, but Accenture has had one for several years, and Target also we've taken some learnings from. So we're going to pilot something there, and that's very similar to what was just said, just making sure that there's more places for employees to reach out to. And it might be a signature line, it might be a badge, but so people know they can ask questions about where to get the resources and support. We are also looking, as I mentioned, at introducing an executive champion. Really hoping this time to do a panel discussion. I kept waiting for 2021 because I wanted to do it live in studio, but that's not happening. So we're going to work on doing that from a virtual perspective. And then we're also working to grow virtual mental health. So obviously, a lot of clinicians have moved to that in the healthcare space, but we're also looking at how we can do more with current suppliers to bring more opportunity for telehealth from a mental health perspective. So those are the immediate things in front of us, along with a lot of education and information in May.
Great, thank you. You said the words virtual, and it got me thinking, one of the ways that I have been working with engaging communities here in the DFW market is by encouraging some of the ERG partners that I work with other companies to join us for our virtual walks coming up. So our NAMI virtual walks, it's a great way to team build virtually, engage, and also open up dialogue in a safe space. So that might be something for the group to also consider. All right, let's see. So we do not have any more questions in the chat. I'd like maybe closing thoughts from our panelists on, one thing that, I don't know, you take from being in this group, or one thing that you're going to be working on possibly so that we can all learn from you. Just one thing that you are committed to, or one thing that you're going to be working on this year. And then we'll close. Unless there are any other questions coming in, we'll give you guys back your time. So Kelly, any closing thoughts?
And thank you for this opportunity. And I think somebody, I can't remember who had mentioned, maybe Katrina had mentioned the creative aspect, and a lot of our employees are leveraging storytelling. They're sharing their story on our intranet portal, either in posts or like longer length blogs. And I just feel like it's so important, just based on, they're getting a lot of likes, they're getting a lot of comments, and people are taking on tough topics. A lot of blog posts around grief. We've had a lot of loss. And again, just saying, like, I'm experiencing this. There are days where it's not okay. I'm not okay, but that's okay. Just sharing their grief and their loss, being open about addiction, or being open, also sharing about their mental health vulnerabilities, their experiences. So they're sharing that online very publicly, but what's great is that it's a safe place. People are so appreciative. Their comments are like, this is important to remove the stigma. It's important to keep sharing your story. So a lot of comments around, thank you so much for sharing. And so I think that's going to be an important, initiative going forward, just so that we can create these places to either courageous conversations or online, so people can share their stories, and that peer-to-peer support.
Yeah, you want to meet your employees where they want to be met, and so you certainly bring up a great point. Thank you so much. Tara.
I'm just greatly encouraged, I think, by everyone here, by the other panelists and those that have joined today and shared. I think that sometimes the mountain feels so high for us to climb, with all the need that we know is out there and all the work that we know needs to be done. But it's very heartwarming and inspiring, I think, just to see everyone dedicated to this. And I think together we can do it. So I'm really looking forward to more sessions like this where we can learn from each other. I'd love to hear things other organizations are doing too. It's funny because sometimes it's that tiny little hint that gives you an idea that you can run with, and it might be in a different way at your organization. But that's why I really love these opportunities to share, because those tidbits can be so helpful. I'll be out of the office for a week, but I'm more than willing if anybody wants to chat any more about any of these topics, or if you're doing something great, I'd love to hear it too. So just more of this, and it was very inspiring. So thank you, everybody, the co-panelists, NAMI, and everyone who joined today for a great session.
Thank you, Tara. You touched on something that really struck a chord with me. There's a lot that's been canceled in the world in the last year plus, but hope is not canceled. We're all here doing the work and continuing the conversations. And so thank you. Thanks for being here. Brian.
Yeah, again, thanks for hosting this, and it's some really wonderful stories and ideas we can definitely take back as well. Dan, let's get back with the team and think about how we keep momentum going. I think we start to think more about return to normalcy, getting back in the office. We're looking maybe the back half of the year. I think we'll have to still recognize that it still won't be normal, even if people are back. I think the stress and strain of the last year plus is going to persist, and so I think that's where we're really focusing on. How do we try to get some of our kind of normal cadence back that we had before the pandemic, but also recognize that the stories we've heard of last year will continue. There'll be a lot of challenges for our team members outside of the work. And so just maintaining flexibility, keeping that open dialogue. We've empowered our team members to be able to perform, really however they feel fit when they're at home. We don't really have visibility into what they're doing, and they've done an amazing job. So not losing sight of that, and making sure we give everyone still that ability to adapt to their changing environment at home. And I think that's something we all need to keep doing, even as we start to, if we're back together, but it won't be the same for a long time.
Thank you. Thanks, Brian. Dan.
I just want to bring up again, we've gone through so much as a population. We talked about the pandemic, the heated political temperature that unfolded. There's just been a lot of reasons that put stress on everyone. And as we start to heal and move beyond, to what post-pandemic America looks like, I think that now is where we're going to see people finally able to stop and breathe and finally acknowledge their own mental health. And so I think now is probably the right time where if you don't have those resources together to help employees that are going to be looking for those, it is the right time to get those resources together and know how you're going to guide them and what resources are going to be available to them. Generally, it's always after a disaster and after the physical injuries are taken care of that mental health begins to manifest itself. So we're walking right in that perfect timeline now to where a lot of people are going to be reaching out for help, and it's a good idea to know how we can help them.
Thank you. Ken Duckworth says often when he is doing media interviews or talking, he'd say, this is the next pandemic, and it's here. The mental health pandemic is here. And now more than ever, our employees, our communities need us to step up as leaders. Before I, wrap this up, I said earlier, we want to meet our employees and communities where they want to be met. So for the 43 of you that are still on this call, if you are open to it, I'd love to be able to see you on camera so I can take a picture of you and continue this dialogue on LinkedIn with you. So camera on. And if you're okay with me taking a picture, we can give you guys shout outs. I see Jessica fixing her hair. Awesome. Thank you. Look at that. We have volunteers here. All right. We will continue this conversation on LinkedIn at NAMI, at NAMI.org. We just want to say thank you to each and every one of you for making space in the workplace for your teams. Our esteemed CEO is on my screen, and I cannot close this conversation without handing the microphone back to him. So Dan, help us close this up. Thank you.
Oh, thank you very much, Vanessa, and fantastic facilitation and moderation. This has been a wonderful conversation, wonderful discussion. Thanks for all that every one of you all do in your organizations, and thank you for your partnership. And we are all in this together. You're not alone, and it will take all of us. So we wish you the very best as you close out your week. And again, thank you for your partnership with us. All the best.
Thank you.
Thank you, everyone. Have a wonderful week. Bye.
Thank you.